Good morning and welcome. I'm Paul Carson, Training and Development Specialist with Care Oregon's Pharmacy Department. And I'd like to welcome you to this morning's special Meds Ed presentation, Striking Back Against the Rise of Diabetes During COVID-19. COVID-19 has taken up our full attention, while other vital chronic conditions have ended up taking a bit of a back seat. It's kind of like our house has been on fire and we've been consumed with fighting that blaze. But meanwhile, the unstable ground that our house is built on has continued to slowly erode beneath us. And while that fire may still be burning, we can't afford not to deal with the ground that our home is standing on. The US saw alarming increases in the death rates for diabetes and other common killers in 2020. And a big reason for that may be that people with dangerous symptoms made the lethal mistake of staying away from the hospital out of fear that they'd catch the coronavirus somehow. As a result, diabetes deaths rose to 24.6 per 100,000 last year, up from 21.6 in 2019. And that translates into about 13,000 more lives lost from diabetes than in 2019. It's a 14% increase. It was the largest diabetes death rise in decades. And as you know, exacerbating the situation, people with diabetes, both type 1 and type 2, are more likely to have serious adverse complications from COVID-19, and a risk that's likely to be lower if diabetes is well managed. Now more than ever, we all have to come together and step up our efforts to reduce the burden of this serious disease. And that's what brings us together here this morning. Today, we're extremely fortunate to have a fantastic panel of clinicians joining us to present some new and impactful best practice guidelines to effectively treating this challenging disease state. And we're going to give you some practical tools that you can use to help turn the tide. So let's go ahead and take a look at what our program is going to consist of here today. This is a rough breakdown of our agenda for the different segments we'll be covering, stretching from about 8 o'clock to ending up a little bit before noon. We're going to start off with an overview of the current situation. We have one of the top diabetologists in the area who's going to go through here and talk us about managing things in more practical ends. And he's also going to be able to answer some questions for us today as well. And then we have our very own Corey Bradley from Care Oregon, who's going to discuss navigating medications and our new pathway that we have to help figure out when do I use which medications most effectively, depending on what's going on with my particular patient. And we'll have more time for Q&A as well after those sessions. So I think we've got a jam-packed morning for here today. These are the basic fundamental learning objectives that our three presenters are going to be covering for us. And nice reminder, your time is going to be well compensated here today in terms of free continuing ed hours, depending on whatever it is you need. We have regular AMA equivalent CME through the American Academy of Family Physicians. That translates into Oregon Board of Pharmacy credit, if that's what you're in need of. And we also are fortunate enough to get CEU credits through the National Association of Social Workers as well. At the end of the presentation today, I'll tell you a little bit more information about how that works, plus a new option that we're just rolling out with this particular session. So I think you'll find that very interesting as well. Want to mention just on the front end here, there are other sessions that are coming your way very soon. We have a terrific session that's targeted about the value and impact that community health workers can make. That's just a couple weeks down the road on September 16th. So I definitely encourage you to also sign up for that course. If you haven't already, you can just scan that QR code in order to be able to go ahead and enroll. And we're working right now on developing content for the fourth quarter of this year on introducing more cultural competency to the way illness and pharmacy come together. So I think you're going to find that to be an incredibly relevant and helpful session as well. So more of that and more information at the end of our program here today. As always, we try to make this as interactive as possible, given the constraints of doing this in a webcast format. So please know we will be working with you on the chat function of your webinar here today. Asking questions is encouraged for all the presenters. If you have any that you'd like to use there, however you'd like to do it, we'll keep track of those questions, and as much time as possible, we'll be able to run those questions past our presenters during their individual segments. So you have lots of good opportunities there to go ahead and begin. And now I'd like to go ahead and take a second to introduce our very first presenter to kick things off this morning. Care Oregon's very own Melissa Brewster is a board-certified senior pharmacy clinical coordinator for us. She provides clinical expertise on medications and substance use disorders to Care Oregon and its many affiliates. When she was at the University of Utah, Melissa was awarded the Elizabeth Furman Gardner Prize. It's recognizing an outstanding woman in the health sciences for her work initiating and passing syringe legislation in the state of Utah. She completed her pharmacy practice residency at the Alaska Native Medical Center, where she focused on the psychiatric needs of patients in rural areas. She was instrumental in the creation of the VA's National Opioid Safety Initiative and was recognized by the College of Psychiatric and Neurologic Pharmacists for her innovative work implementing the first broad-scale pharmacist-managed naloxone program in the country. Wow, are we ever lucky to have her with us? Please join me in welcoming Melissa Brewster. Melissa, take it away.
Good morning, everybody. Thanks for joining us for our MedZed today. My name is Melissa Brewster, and I'm a senior pharmacist at Care Oregon. And today I'll be talking a little bit about how COVID-19 has impacted chronic disease management and diabetes treatment in our clinics. The objectives for today's presentation, I'll talk a little bit about how COVID has impacted you in your clinics, what we've seen kind of around the state and the country on how COVID's impacted clinicians. We'll talk a little bit about chronic disease management and what has changed during the pandemic. And then we'll discuss some of the ongoing challenges and opportunities for treating diabetes. I want to start this talk by acknowledging some of the challenges that clinicians are facing right now. It's been a grueling year and a half of really rapid changes in your practices. There's been risks to your personal safety and ongoing kind of patient denial and COVID vaccine refusals. The work of being a clinician in any practice right now is likely the hardest that it's ever been. And to you on the front lines, seeing patients with varying levels of acute illness combined with depression or stress or social factors like homelessness that we know have increased during this pandemic, your resilience in continuing to show up every day is remarkable and commendable, and I cannot thank you enough. This will likely be the largest challenge of your careers in healthcare. And right now, when we saw a glimmer of hope this spring, it's exploding again, and you are again being thrown back into this battle. Brene Brown said that daring greatly means the courage to be vulnerable. It means to show up and to be seen, to ask for what you need, to talk about how you're feeling, and to have the hard conversations. So I ask, please be caring for yourselves right now, for your mental health and for your boundaries. Ask your leadership for what you need. Take breaks, drink water. We continue to need you on the front lines. We are hemorrhaging clinicians right now who are burned out and can't take another day. And so I ask that you find a way to continue to show up, to have those hard conversations with your staff, to mourn together and to build each other up. Self-care has been really stressed in the past many months, and for clinicians who are strapped for time, you may be wondering, what does self-care actually look like? So I wanted to give you just a couple of pointers on what you can do or what you can ask for to support you in your work. First of all, caring for your basic needs. And what does that mean? Asking leadership to bring in food into your break areas. Maybe you need naps during the day, asking for a nap area or help with childcare or transportation, making sure that your PPE is comfortable. And if you need additional time off, to really sort of invigorate yourself, asking for that from your leadership. Also, we know that as practice has been changing, the rules have been changing, that there's been additional need for training and for communication from your leadership. So making sure that that's happening, and if not, asking your leadership for that clear communication. Access to resilience and stress reduction training can be really helpful. Things like breath work and time outdoors, having a self-care plan are really important in anticipating kind of your upcoming stresses and making sure that you're planning for them. Making sure that you're acknowledging the moral injury to yourself and to your staff and the impact that COVID has had on patients and on their wellness as well. And then knowing when you need to access mental health care. We have seen a spike in suicide among clinicians, acute stress disorder and PTSD happening from COVID. There's been a significant increase in insomnia, depression, anxiety, and really nurses and women are particularly at risk, as well as younger clinicians and people with children. So really making sure you know how to access your mental health care, normalizing that among your staff, and getting the help that you need. So there are a couple of really distinct challenges of how COVID-19 has impacted the treatment of chronic disease. First of all, how do we prevent those who are at risk of COVID or have chronic diseases and are at risk for severe COVID in getting that disease? And then inherent in that is the need for balancing, protecting people from COVID while making sure they can still engage in treatment and getting their conditions treated effectively and safely. Secondly is the post-pandemic impact of COVID on the prevention and identification and management of disease. So we have seen decreases in preventative care, disease management care, and a significant reduction in ED use during the pandemic. We know that 4 in 10 adults have reported delaying care or avoiding care in the past 18 months. And a study has shown that the decrease in cancer screenings and identifications will likely result in around 10,000 preventable deaths. We've also lost ground in pediatric immunization, mental health, and substance abuse. And in fact, 2020, we saw the largest overdose death rate that we've ever seen. Over 93,000 people died in the United States from overdoses. And this is likely related to pandemic factors. And then the third biggest challenge of COVID-19 is really the long-term sequelae, that long COVID that we're seeing, both as a disease entity and from a population perspective. We know that 5 to 20% of patients will have symptoms that last over 4 weeks, and many are lasting months and months. We're still learning a lot about COVID, long COVID, and what those symptoms look like. So how can you assess the impact of this pandemic on what it's done to your practice and to your treatment of chronic disease? So first of all, looking at what diseases have been missed or allowed to worsen. And you can do this by looking at your data or asking your CCO for data on your quality metrics. What is the status of prevention and disease management efforts in your clinic? Are you doing your standard outreach to patients? Have some of those things been sort of delayed while you're focusing on vaccine efforts? What's the current status in your clinic? Have prevention and disease management efforts been affected by concerns such as job loss, loss of insurance, lack of access to food, or places to work out like gyms because things have been closed? And then how has the pandemic affected your staff in terms of staff reductions? Have you seen people quitting or had a high level of turnover? Are practices closing because you're shunting staff to hospital systems, which is happening in some clinics? And then how is that reduction in staff impacting your chronic disease management? A study that was done looking at diabetes monitoring during COVID showed a significant reduction in the early months of the pandemic. So the black bars you're seeing in this graph, this is the month immediately prior to the pandemic. And then the gray bars are showing the levels of A1C testing in those months immediately afterwards. So we're seeing significant reductions in diabetes monitoring during COVID. That looks like it's impacting both the youngest age group and the oldest age group, who are much more fragile and probably more likely to not come into the clinic during the pandemic. When we look at diabetes poor control rates, this red bar indicates when lockdown started. So for diabetes poor control, lower is better. And these three bars on the graph, so the orange bar is our Southern Oregon region that we call JCC. The gray bar is our coastal region, and the blue bar is our Portland metro region. So you can see immediately following the lockdown and the pandemic, we saw much worse control of diabetes happening, and that's continued to increase during the pandemic. So, and then what are we seeing related to the rates of complications among people who have diabetes controlled versus those who don't have diabetes controlled? So COVID complications are significantly higher in people who have an A1C greater than 6.5 compared with those who do have their diabetes well managed. So much higher rates of secondary respiratory infection, higher rates of acute respiratory distress, critical illness, and then twice the rate of death related to COVID for people with poor diabetes control. So there's still some data emerging on whether or not COVID-19 actually causes diabetes. We do know that the COVID-19 virus does enter the pancreas and attaches to those beta cells that are really critical in creating insulin. And it does both kill those cells and reprograms those cells as well. One Italian study showed that 46% of patients with COVID admitted had new onset hyperglycemia, so never having any diabetes before. And for a third of those patients, that hyperglycemia lasted 6 months or longer. There's also some new data coming out that shows that sitagliptin, which is a DPP4, may actually reduce mortality in patients with diabetes and COVID-19 because it prevents the virus from entering those cells in the pancreas. So what can you do in your clinics to help get patients back into care and back into managing their chronic disease? So first of all, raising awareness, talking to your patients about what their fears are about returning to care and allaying those fears, explaining what you've done for safety and cleanliness in your clinic to make sure that they know you're doing everything that you can to prevent COVID from spreading in your actual clinic. Re-emphasizing the importance of getting back into care and of continuing chronic disease management. Really helping patients to gain more confidence around the COVID vaccine and making sure you're vaccinating anybody who is willing to get that. And then get an understanding of how COVID has disproportionately affected communities in your area. Looking at COVID-19's impact from an equity lens, this is another area that your CCO can help you in getting data and taking a look at those different populations. Secondly, collaborating on solutions and building trust with partners in your community. We know that public health has really played a critical role during COVID in addressing health behaviors, eating healthy, physical activity, tobacco cessation, substance use treatment, and also a huge partner in our vaccine efforts. And they really have access to some of those community solutions that can address the social determinants of health that impact both prevention and disease management. We know that some of our community groups are critical change agents, and creating these relationships are really particularly important in addressing social determinants. We know that social determinants have really been amplified as a direct result of COVID, and it's going to require kind of a multi-system approach of us all coming together in order to solve some of those problems. The third thing you can do is to innovate. We know that telemedicine has really exploded during COVID. That's been one of the upsides and benefits we've seen of this pandemic. So really continuing to leverage that technology to expand the reach of healthcare and to promote that among your patients. Also providing more treatment in community settings. So things like the diabetes prevention program is done oftentimes not in clinics, but in a community program. And so making sure that those are offered in your area and partnering with those and getting patients referred into some of those programs. Also use your community health workers or traditional health workers to help assist connecting your patients both to back into treatment in your clinic and to community resources. Further increasing and enhancing approaches to getting treatment at home. So are there options for doing testing or monitoring in home? There are some community paramedicine programs where they'll actually go into the home and do A1Cs for patients, or can you get your patient a monitoring cuff for hypertension where they can take their blood pressure at home? So making sure that you're getting those services out to people who may be a little more hesitant to come back into clinic. And then watch out for how increasing technology can actually magnify disparities. So making sure that technological solutions are easily accessible, that they're available in multiple languages, that they're compatible with all types of hardware, including telephones. You know, some people don't have computers, and that they're culturally appropriate. We really need to expand both computer availability and internet access for our patients in order to keep kind of leveraging some of these technologies. And then lastly, so addressing the long-term sequelae of COVID. Long COVID is something we're still all learning about. We know that there are psychological and neurological complications. So really listening to patients about what their ongoing symptoms are. We are starting to recognize that there may be some association between long COVID and chronic fatigue syndrome. They're looking to be like very similar syndromes, and chronic fatigue is something that we actually have sort of dismissed in healthcare for a really long time. And so there is the possibility that we're going to be really putting a lot of money and research into long COVID and how to treat it, as well as chronic fatigue syndrome in the next many years. So following that research that's coming out, so you are kind of on top of what you can do for your patients experiencing those long-term symptoms will be really important going forward. I wanted to talk briefly about dental care and diabetes. This is also really critical because we recognize that periodontal disease actually can worsen or cause diabetes because of how pathogens increase systemic inflammation, can cause higher blood sugar and insulin resistance. So it's sort of this cycle that can be continuous and really damaging to health. This is probably one of the reasons why OHA has introduced a quality metric around getting dental care for people with diabetes. So it's really, really important for you to think about getting your patients into a dental visit at least twice a year if they have diabetes. And so what are some ways that you can do this? So firstly, identify some common barriers of why patients aren't getting access to dental visits and trying to remove some of those barriers. Making sure patients understand that they have coverage for dental care and why it's important. So explaining to them kind of that cycle on the previous slide of how periodontal disease can worsen their chronic disease management, and so why dental care is so important. Making sure that you're building bridges between your clinic and the dental clinics who are in your region, and then using the Care Oregon Dental Portal to get patients scheduled. It's a really simple way to get patients in for a dental visit that kind of minimizes your work and gets the DCO involved and has them call the patients and connects them to a dental visit. Use some common sources for integration, making sure that you are sharing your methods across teams around common platforms and messaging. So using your EHRs, your registries, using your panel coordinators to do outreach to patients. And then increasing your collaboration pathways. So is there a way you can close the loop on dental referrals? It's really challenging to do closed loop referrals for any kind of specialty care, but what can you do around referrals for dental care that you're ensuring that those patients are getting into treatment? In summary, thank you so much for your ongoing dedication to your patients in these very disheartening times. Make sure that you are taking care of yourselves and your well-being. Take space, drink water, ask your leadership for what you need in order to support yourselves and to keep going every day and showing up in clinic. Make sure that you're assessing what the impact of delaying chronic disease treatment is in your clinic. You can ask your CCO again for data on your performance and for help with quality improvement efforts. Make sure that you're removing some of those barriers and fears for patients who are worried about returning to clinic because of the impact of COVID. Continue some of those innovations like telemedicine and help patients get access to the technology that they need in order to take advantage of those technology services. Continue to monitor for long-term issues from COVID and stay on top of the research that's coming out. And then finally, get your patients with diabetes in for dental exams. It's so critical, and it's likely one of the most neglected services during this pandemic. Thank you all for coming to our MedZed today. It's been a pleasure to speak to all of you, and hope you have a great Monday.